Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about recovery after the birth of twins, triplets, or more. We've said pregnancy is like running a marathon. Pregnancy with multiples can be even more challenging. If you had twins, triplets, or more, your recovery may be a little more difficult for several reasons. Pregnancy with multiples can be harder on your body than a singleton pregnancy. The risk of problems or complications is higher. You may have experienced greater discomfort such as swollen ankles, pelvic pain, back pain, and pelvic floor issues. Stretch marks, varicose veins, and hemorrhoids are also more common. You may have gained more weight or experienced more edema. You needed to gain that extra weight to support your pregnancy, so don't beat yourself up if it takes longer to lose those extra pounds. You may also have more bleeding as your uterus heals. You may have had a cesarean delivery. That means you'll be recovering from major abdominal surgery, and it will take time. It takes longer for your breasts and belly to return to normal size. Moms of twins often have higher rates of diastase recti, the separation of your abdominal muscles. When you get the go-ahead, you may want to do some physical therapy to help the healing process. A multiple pregnancy often delivers early, so you may not have had time to prepare to bring your babies home. Gestation for a singleton pregnancy is about 280 days. For twins, it's about 260 days, and for triplets, it's about 247 days. Ask for help from family and friends. Another problem with early deliveries is prematurity of the babies. If your babies are premature and have to stay in the hospital, this can create emotional stress for you. If you want to breastfeed your babies, you may have to express breast milk at home and bring it to the hospital for your babies, or you may want to nurse them there. An added stress is that you have two or more of everything: diapers to change, babies to feed, clothes to wash, but you have no extra time. Ask for help from your partner, family, and friends. Don't be shy. Many people are just waiting for you to ask. And as you recover and the babies grow a little older and get on some kind of schedule, life will go more smoothly. Be sure you get enough rest. Your body needs time to recover, probably more time than if you had only one baby. You may be more tired because of lack of sleep, anemia, and the need for more calories, especially if you breastfeed. Eat a healthy diet. It takes more calories to make breast milk. You may need to eat even more calories to make breast milk for multiples. Talk to your doctor about the best diet for you if you nurse your babies. Drink lots of water and other fluids during the day. Aim for about 3 liters every day. Don't forget to treat yourself occasionally. Maybe order delivery of food you couldn't eat during pregnancy. Don't overdo it. Do what you can: laundry, keeping babies clean and well-fed, taking care of yourself and your partner, and let the rest go. Your body has just accomplished an incredible feat. Realize it can take some time to feel tip-top again. Be kind to yourself. You and your babies and your partner will be glad you did. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.